Hello, everybody. Thank you so much for joining me here on Wave Now's Ask the Doc. I'm Myra Ansari. Hope that your day is going well so far. All right. If you spend some time outside, you really need to listen to this segment here. I love to go on walks. I love to go on trails with my family and my dog, but I'm always paranoid about ticks. Maybe you're in the same boat as well, because we're in that season right now where ticks are out, and we know that they can be very dangerous to our health. So joining me now is Dr. Kristina Bryant, a pediatric infectious disease specialist with Norton Children's Hospital, here to give us what we need to know about these creepy, crawly, yucky little critters that are out there and how we can keep ourselves and our children safe. Dr. Bryant, always good to talk with you.
It's great to see you, Myra.
So what type of ticks are in our area? What do we need to be careful about, and why are ticks so dangerous?
So we are definitely in tick season. The weather is warm and ticks are biting. You raise a great point that ticks carry different diseases in different parts of the country. And so the most common tick-borne diseases we have in the Louisville area are Rocky Mountain spotted fever and ehrlichiosis. Occasionally, we see some cases of tularemia as well.
All right, so some of these diseases that we can get from ticks, they can actually be very dangerous, even fatal. How is that?
That is very true. So let's take Rocky Mountain spotted fever. That can cause severe illness if it's not treated, and people can die from it if they do not get antibiotics in a timely manner.
How do you know if you've been bit by a tick? What's the obvious signs?
So some people will actually find a tick attached. Some people may develop a red bump and wonder if they've had a tick bite. But many people, if not most people, who have a tick-borne illness don't know they've been bitten. And so I think it's more important to know the signs and symptoms of tick-borne illness. So fever, headache, muscle aches. And then in the case of Rocky Mountain spotted fever, several days after those symptoms start, patients may develop a rash. Now, initially, this just looks like flat red spots. Often it's on the wrist and ankles. It may spread to the palms and soles. And then over time, it may look like little red dots that look like bleeding under the skin. That's the rash of Rocky Mountain spotted fever. So those symptoms can go along with a lot of illnesses, but when those symptoms are present in the summer and people have been outside, it's important for clinicians to think about tick-borne illness.
All right, so I'm just rolling some video of some ticks, and I get a little freaked out looking at them, so paranoid about it. But there's another, hearing a lot of cases about babesiosis. Hopefully I'm saying that correctly. It's a rare tick-borne illness on the rise in the Northeast. What is babesiosis, and should we be concerned here in our area?
Babesiosis is caused by a parasite that is carried by ticks, generally Ixodes ticks. And as you pointed out, it's more common in the Northeast and in some of the upper Midwestern states. Earlier this year, the CDC released a report that the babesiosis cases are on the rise. And cases were going up in states where this disease was not so common before, including Maine and New Hampshire and Vermont. And so I think it's important for people traveling to the Northeast, including these states, to know about this, to take precautions against tick bites. And if they develop fever and muscle aches, body aches, headaches after they come home, then it's important to let their doctor or healthcare professional know where they've traveled. The interesting thing about babesiosis is the parasite gets into red blood cells and can cause the red blood cells to burst, and patients can develop a bad anemia.
Mm.
Fortunately, babesiosis is not so common in Kentucky.
So what do you do, Dr. Bryant, if you see a tick on your skin? And also, another question to that: does most of the stuff for ticks apply the same way for adults and children as well?
Yes, to tick repellents. There are a variety of insect repellents that will work for both adults and children. Many of the common insect repellents contain DEET, but there are preparations that contain other insect repellents. For anyone who's interested, the CDC has a nice list of insect repellents that have been approved by the FDA. I think it's always a good idea for parents of young children, let's say those under 3, to talk to their pediatrician about what's safest for their child, because there are some of these that we don't like to use in kids under 3 years of age.
Okay. So if you see a tick on your skin or your child's skin, what do you do, Dr. Bryant?
So if the tick is embedded, it's important to remove it as quickly as possible. Use tweezers. So grasp the tick close to the skin, and pull straight up. No twisting, because if you do it that way, there's less chance that pieces of the tick will remain embedded in the skin. Removing with tweezers is the recommended way to pull off an embedded tick. You don't want to use your fingers. You absolutely do not want to try to burn it off or smother it. Just remove it using
And
tweezers.
how do you know if it's embedded? Is it obvious? Do you feel it?
If you, it'll be stuck to the skin if it's embedded. If it's crawling, you can just brush it off and you're done. But if it's not moving, there's a fair chance that it's embedded, and so remove it with tweezers. Now, ticks can be really tiny, and so many people might not notice a tick bite. So if you've been outside, particularly in an area with tall grass or a wooded area like the pictures you showed, when you come back in, it's a good idea to check for ticks. Parents should check their children for ticks. And you want to check the scalp. You want to check behind the ears, behind the knees, even the belly button. Ticks can be there too.
Oh,
And so a careful tick check is important if you've been outside in places like that.
okay. So what do you do with that tick after you've removed it? I've heard so many things over the years. Put it in a plastic bag, send it to the health department. What do you do?
You can save it and share it with public health. But I think most often, right, we're not going to you don't need to send it off most of the time to check for diseases, right? You don't usually have to do that. An easy thing to do is just to flush it down the toilet. You can put it in a plastic bag, seal it up, put it in the trash. You can wrap it tightly in tape and put it in the trash.
Okay, so we have a question from a viewer. Galena Golden Tull wants to know, if you remove a tick that was obviously engorged, is it best practice to get tested immediately, or do you wait for possible symptoms? Is there preventative medication that you can take to fight the possibility of Lyme disease? That's a really good question.
That is a great question. So in Kentucky, preventative antibiotics are not recommended after a tick bite, because the most common diseases that you get from tick bites in Kentucky are Rocky Mountain spotted fever and ehrlichiosis, and preventative antibiotics haven't been shown to help. If you get a tick bite, let's say if you're traveling in the Northeast if you're traveling in Massachusetts or Pennsylvania, where Lyme disease is common, sometimes preventative antibiotics are recommended to prevent Lyme disease, but there are a series of criteria. So in Kentucky, because of the kinds of tick-borne illnesses that we see, you just remove the tick, wash the area with soap and water, watch for symptoms, know the symptoms that are concerning. So fever, headaches, muscle aches, and often rash.
Okay, perfect. Dr. Bryant, this was very helpful. Is there anything that I didn't ask you that you want our viewers to know today?
I think the most important message is it's tick season. Um, the CDC will say avoid tick infested areas, but we all like to be outside in the summertime. So use an insect repellent, check for ticks, and know when to call your doctor.
All right, we have one more question. Shirley Hampton wants to know, what is the second disease? I think we talked about Lyme disease. We talked about ehrlichiosis. Shirley, I'm not sure if that's what you're referring to. And the other disease that we talked about was babesiosis, right?
Yes, and Rocky Mountain spotted fever.
Yes.
So in Kentucky, the most common things that we see are Rocky Mountain spotted fever and ehrlichiosis. Ehrlichiosis is a disease that is a lot like Rocky Mountain spotted fever, but rash is less common. And so unofficially, the people have said ehrlichiosis is they've called it Rocky Mountain spotless fever, but that's not its official name. Sometimes you can get a rash with it, but not as often. So fever, headache, muscle aches, those are overlapping symptoms with Rocky Mountain spotted fever.
Okay, great. Dr. Bryant, always great to talk with you. This was very helpful information. As we all spend more time outdoors, we want to make sure that our summer is safe. I'm Myra Ansari for Ask the Doc with Dr. Kristina Bryant from Norton Children's Hospital. Have a wonderful day.
Thanks, Myra.
Thank you.